Can't hear you. Can't hear you, Anne.
I'm Anne Brown and I represent the Wellness Committee, and I'm delighted to introduce Anne Lipscomb from the Wellness team, from the clinic. And most of you probably know her, so I'm not going to go into a whole big long spiel. She'll tell you anything she wants to tell you about herself at the end of the talk. So at this point in time, I'm going to let Anne talk to you about chronic care management.
Okay.
Thank you, Anne.
Okay, this is a good crowd. This is a good crowd. More than I thought. I mean, it's not a very sexy topic. So this is about a program that is a Medicare program called Chronic Care Management. And it was established by the Centers for Medicare and Medicaid Services, which is the kind of overarching agency for Medicare. And it was established in 2015. It was found that, surprise, surprise, there's not very good follow-up by doctors or nurse practitioners for people that have more than one chronic condition. You go into the doctor and a lot of times you're just dealing with, okay, what's going on today? Or you're going in to talk about one thing, your blood pressure or your cholesterol. But most of us have a lot more going on than that. And it was found that there was very poor coordination about chronic conditions. And then they studied if people do better, if they live longer, they're in the hospital less often, if somebody is coordinating their chronic conditions, the care that they're getting for more than two things, two or more things, so more than one thing. So that's the basic, what is chronic care management? So the talk, this is just kind of a short outline of what I'm going to talk about. Chronic care management, which if you listen to the people in the clinic or the nurse practitioners, they'll call it CCM, and that's what it stands for. And I was going to talk about what it is, what it actually does, who it's for, who pays for it, and why you might think about signing up. So I'm going to start with a little bit of vocabulary because some of this comes into play here. So one of the terms that we'll hear a lot in dealing with insurance and Medicare and the clinic is provider. And people have a lot of questions about exactly what is that? Is it my doctor? Is it the nurse practitioner? And so it's doctors and specialty doctors, so your primary care provider, or PCP, is considered a provider. Your specialty doctors are also considered providers. It can be a nurse practitioner, a physician's assistant, a clinical nurse specialist. A lot of the cardiologists have those providers working with them. So it's a member of your medical team that can prescribe treatment. So this person can prescribe prescriptions, or they can prescribe therapy for you, or diagnostic tests, or imaging. So that's the difference between a nurse and a nurse practitioner on a basic level, is that nurse practitioners can prescribe treatment and therapy. So that's a provider. So in the program, when I'm talking about your provider, it can be lots of different people. I'm also going to talk a little bit about co-insurance. So with Medicare and a lot of insurances, the co-insurance is the percentage of the cost of the care that you're going to pay after your deductible is met. So you've got your annual deductible that you've got to get covered before your insurance kicks in, generally, depending on your policy. And with Medicare, it's generally about 20%. So you pay 20% usually of whatever the cost of your care is, unless you have a secondary insurance. And then a lot of times your secondary insurance will pay that co-insurance. Another phrase that you'll hear a lot with this is chronic condition. So in the medical world, that means something that is expected to continue for the rest of your life. So it's going to be managed, you're going to be able to live with it, but it's not going to be cured. So some examples are diabetes, or heart disease, high blood pressure, asthma, arthritis, kidney disease, dementia, high cholesterol, the list goes on and on. So it needs to be something that, when we talk about a chronic condition, it's something that is going to be managed but not cured. And another phrase you'll hear is Medicare Part B. So Medicare Part B, original Medicare, normal Medicare comes in Part A and Part B. Part A is generally used to pay for hospitalizations, and Part B is usually used out of the hospital for other things. So we move on to chronic care management, or CCM. What is it? I apologize for the tiny writing. Hopefully you can read some of that. And I'll let you know that I have handouts in the back that are from the slides. So if you like that, it's back there. So it's a program that's covered by your Medicare Part B. It was created to improve care for patients and for providers and for the people that are providing the care by coordinating care for multiple chronic conditions and reimbursing the providers for the time that that care takes. So basically, if I'm seeing somebody that has, say, congestive heart failure, they're going to have that for the rest of their life. It can be well managed and they cannot have any symptoms, but they're on medication and they have particular routine labs and testing, particular kind of care. When I see them, I need to go back and look at their last notes. I need to go back and find their cardiology notes. I need to go back into the chart and look at their most recent lab work. Maybe I've called them several times before the visit to discuss, have you refilled your medicines? How much do you weigh? All that time before chronic care management was never reimbursed. So the provider spent time, but there was no reimbursement for it. So chronic care management intends to help with that. So providers are not feeling so pressed when they're seeing somebody to finish everything that needs to get done while they're in the room with you. And the idea was also to reduce the cost of hospitalizations for chronic care condition exacerbations. So the idea being that if medical providers are keeping a little bit closer track of patients, then there won't be as much of a risk for things to go off the rails. You won't start gaining weight and more and more and more without anybody knowing it because somebody's calling and checking in with you. So CCM, what does it do? So when someone is part of a CCM program, the clinical staff in the clinic or the doctor's office can do a lot of teaching about what your chronic care condition is, what the risks are, what the triggers are for making it better or worse, what kind of care you should be taking of yourself. The other thing that happens with chronic care management is there's regular phone contact with clinical staff about your chronic conditions. So that generally can mean a phone call, maybe once a week, once every 2 weeks. It can just be, hi, how are you doing? How is your weight? How are you breathing? Everything's great, fine, goodbye. We'll talk to you next week or 2 weeks from now. Or it can be, oh, you went to see your cardiologist and they changed all your medicine. Okay, let's talk about that. Let's go through your medication list and find out. So it can be 30 seconds, or it can be 10 minutes, 15 minutes. So that's a part of chronic care management that's very prominent, is that people on chronic care management have regular contact by phone with clinical staff. It doesn't mean that you can't call the clinic other times. It doesn't mean that the clinic won't see you if you have a cold or you just need to be seen for anything. You still have all the access to the clinic services. But you also get this extra contact. People with chronic care management program have a clinical staff person coordinating with their other providers. So someone in the clinic who is a clinical staff person, either the nurse practitioner or a nurse, somebody else that has clinical training, is getting records from your other doctors. So there's some place that things are kept. This used to be what we thought of as the primary care doctor's purview. And a lot of times it still is, but I'll tell you, it's difficult and problematic still to get records from other people. So a lot of times you don't know what's been going on. But that's part of chronic care management, is there's someone dedicated to doing that coordination. We try to anticipate and address care needs. So we, as clinicians, know certain things to look for if you have Parkinson's disease, certain things that may be coming up that need to be planned for if you have low back pain. So we try to help people learn about the condition and then anticipate and plan for things that are coming up down the road. And we monitor and address symptoms early. So that comes in with the phone calls. We have a list of things that need to be checked on with certain chronic conditions, and we go through that list during the phone calls. And so we get to check up on, how are you feeling when you walk down the hall? Is it better? Is it worse than it was? We get to talk about, have you gained or lost any weight? So we're not waiting until something goes wrong and you need to come in. We're trying to keep a little bit closer eye. So, chronic care management, who is it for? It's for people that have Part B Medicare. So you have to be over 65. And you have to have Part B Medicare. If you have Medicare, you have Part B Medicare. You need to have 2 or more chronic conditions. And remember, we talked about chronic conditions. It's a condition you have that we manage, but it's not going to go away. You'll have it for the rest of your life. And then another thing that is required is that you're not getting the program through another provider. So a lot of times we see people in the clinic that are seeing an internist, for instance, and the internist is actually already providing this service. So we check with your providers to make sure that you're not already getting this service, because only one provider can do it at a time. So, the nuts and bolts, who pays? So Medicare Part B pays for it. It's charged through Medicare. The charges are determined by the number of minutes that the provider or the clinical staff spends in the service every month. And if they spend less than 20 minutes, then you don't get charged. Medicare doesn't get charged. It's only if the time spent on the care for these conditions goes over 20 minutes, then there starts to become a charge. And your Medicare deductible and your co-insurance do apply. So in that way, it's like going to a clinic or going to a doctor's office. So why would you think about signing up? Why would it be to your benefit? So you have increased contact with other providers, with your healthcare team, and that decreases your risk of emergency room visits and hospitalizations because of worsening of your chronic condition. The other thing that is very different than regular clinic care with chronic care management is that there's a nurse practitioner on call 24/7 for you to call if you have questions or difficulties or concerns about your chronic conditions. If you fall and skin your knee, well, the nurse practitioner is not going to talk to you on the special line about that. But if you start having trouble breathing and you've got chronic obstructive pulmonary disease, then the nurse practitioner is there at night, on the weekends, and during holidays. If you have problems during the day, during the work week, you can call the clinic and it will be dealt with. So the clinical staff spend time updating your medical record so that everybody knows what's going on. Contacting other members of your medical team, reviewing and reconciling your medications, and other things that are related to managing the chronic condition. So this is more for the handout than really for anything right now. It's just other resources. If you have other questions about what is chronic care management, what are the services, these are some websites that you could go to that have good things to read or download. And that's it. I thought we could all take a little vacation to the Rockies. So we have plenty of time for questions or comments, or we can all go home and have some iced tea. Any questions, just raise your hand. Yeah.
In in your first contact with a primary care provider, how do you convince them that you are within HIPAA guidelines, qualified provider?
Then put it up next to your mouth and so.
In your first contact with a primary care provider, how do you convince them that you are qualified within HIPAA guidelines?
So I think what you're saying is, how do you qualify for chronic care management? How do you convince them that
Yes.
you are eligible? You ask them, does your office provide this service? Because not every provider is doing this. So that's the first thing to find out. Is the clinic or office that you're in providing the service? Then I would say, I would just ask them, do you feel like I qualify for chronic care management? If you already know that you have high blood pressure and high cholesterol, well, you're in. Or if you have arthritis and low back pain chronically, then you're in. So you discuss it with the provider when you go to your primary care.
How do you tell the primary care provider that you are qualified to do this and within HIPAA?
I see. So you're asking about me getting information from other doctors about a patient. When you sign papers in most doctors' offices, and certainly in the clinic here, the information that's related to continuity of care is considered HIPAA protected, but it's portable. So we can share it with other people, other providers.
How do you prevent a quack from doing this?
Oh, well, you've got to be a Medicare provider. So I have to be qualified, I have to be credentialed by Medicare. Sorry.
I see so many doctors, I can't remember what I've signed. I may be in this already. How, did I understand you do all the checking to make sure I'm...
Yeah, we need to know, generally, the people that are providing this service are primary care doctors' offices. So usually it's not going to be a specialist. So it's not going to be your kidney doctor or your heart doctor or your endocrinologist. It's going to be your primary care. So the other way is that we know, even if we don't get all the information and we make a mistake and we try to charge Medicare for the service and somebody else has gotten there before us, they won't pay us. So we know that way.
I'm glad we have the clinic phone number up there. And what about the phone number for them?
Yeah, she's asking about the special secret phone number for people on chronic care management. And we only give that out to people that are on the program because that's all we can talk to.
Thank you very much.
Okay, well, if it's something that you're interested in, I would say give a call to the clinic or make an appointment to sit down and talk with one of the nurse practitioners or talk to your primary care provider. This is not something that you have to do here. You could be doing it through your regular internist or family practice doctor. So if it's something that sounds interesting to you that you think might be helpful, talk to the person that you're seeing for your health care. Okay.
Well, thank you, Anne. That was very informative and very helpful to all of us. So, on that note, we'll let you get back to work. Thank you, Anne.